Hi everybody, welcome to HealthLINE. I am Gregory Zarian, so fall is here. And that just means you put on some sweaters, you're wearing some gloves. It does not mean that you do not go outside, work out, wear your masks, wash your hands, socially distant, and just pay attention to yourself and your friends and family. The only thing different that's happening in our world and in our lives is we're having more of a conversation about our health and our wellness. It's also flu season. So we have COVID, we have the flu, we have all of this going on. It just means that we have to be a little more attentive to ourselves and the ones we love. And if it's as simple as wearing a mask and washing our hands and being socially distant and paying attention to the ones that we're involved with, if you're not feeling well, don't go to work, don't go to school. It's just having more of a conversation. It's also October. October is Breast Cancer Awareness Month. That means to get your pink on. In this year, 2020, an estimated 276,480 new cases of invasive breast cancer are expected to be diagnosed in women in the United States just this year. The numbers are staggering, but we also know there's ways to prevent. Women forget their mammogram. They forget to ask questions and take care of themselves. So we decided to bring back a friend of the show, Dr. Dennis Holmes, breast surgeon from Adventist Health Glendale. One of my favorite people.
Great to be here. Thanks
Welcome
so much.
back.
It's a pleasure.
Doctor, just out of the gate and in my intro, COVID, everything that's going on, how afraid should women and men be to come back into the hospital in case they're wondering if they have breast cancer or signs and symptoms?
Well, that's certainly been a concern over the last year with many hospitals sort of shutting their doors to visitors. But, you know, things have improved considerably, and we now have new safeguards for maintaining the hygiene of a medical facility. So I think it's a safe time for women to come back to screening. In fact, you know, they could have continued to screen throughout the last year.
Sure.
But especially now, you know, now that we have this window of opportunity, we're not deep into flu season, COVID's a little bit better control. This is the time to have screening completed if it's not been performed yet this year.
And again, because we're already going to head out to our first break, it is October and it is Breast Cancer Awareness Month, which means the conversation is all about signs and symptoms, health and awareness, and everybody throwing on their pink.
Yes.
Okay, when we come back, more with Dr. Holmes. And I have an idea. Get a glass of water, have a carrot stick, do some stretching, and maybe do 25 to 30 jumping jacks. It gets your heart going, and you possibly could drop a few calories. We'll see you on the other side. Welcome back. Adventist Health Glendale continues to be open for you and your family, friends, and loved ones, and safe for patients to visit the emergency room when there is a need. Adventist Health Glendale has eased some of the visitation restrictions put in place for COVID. They are 1 visitor per patient for the duration of their stay. You can learn more about the full visiting hours and guidelines policy at adventisthealth.org/Glendale. And you can find everything you need on the website. October is Breast Cancer Awareness Month, so we decided to bring back one of our favorite friends, Dr. Dennis Holmes, breast surgeon from Adventist Health Glendale. And I also hope you did a lot of jumping jacks, drank some water, and maybe threw in a few push-ups. Doctor, can you please give us some of your medical history again?
Well, I'm a breast cancer surgeon.
Okay.
I've trained to treat breast cancer, both using surgical techniques as well as some radiation techniques, as well as non-invasive techniques that are alternatives to surgery. The goal is to provide women with effective solutions that reduce the burden of breast cancer treatment.
What schools did you attend to get you to where you are today?
I'm a graduate of Tulane University Medical School,
Okay.
and also a graduate of the University of Southern California Breast Surgery Fellowship Program.
There were so many choices in regards to what type of doctor you wanted to be. What was it with breast cancer and breast cancer surgery?
Well, my interest in cancer surgery has to do with the fact that I had several family members affected by cancer, and I focused my interest on this. And then, as I, had conversations about with family and friends, or just acquaintances, I kept hearing this recurring theme of breast cancer. Everyone had someone close to them or were personally affected by breast cancer, and it really called a need to address this solution. I also heard over the years of many concerns about the treatment, that the treatments may be quite severe. Sometimes the fear of the treatment prevents people from getting
Sure.
screening. And so I focus my research and subsequent activities on techniques that reduce the burden of treatment so that the treatment itself would not be a barrier to getting diagnosed early.
And I love that because a lot of most of the doctors we have on the show say it's a personal connection that gets them into the specialty that they practice
Yes.
on. 2020, where are we in regards to breast cancer and early detection? Are we better? Are we worse?
Well, in general, we are better. I mean,
Right.
breast cancers are being diagnosed at an earlier stage. And
Why do
so,
you think that is?
Well, because of greater awareness about screening.
Love
I mean,
that.
thanks to this show and similar programs and a lot of awareness and the fact that this is a very sort of a public illness. People talk about breast cancer a lot. There's a lot of awareness of breast cancer. So people, even though not everyone gets screened regularly, people have a greater awareness of the importance of screening, the importance of early detection. And that in and of itself is the most important component of improving breast cancer survival. There's also more effective treatments. We have more effective drug treatments as well. So even people presenting with more advanced stage cancers have a better chance of surviving a diagnosis.
When we heard years ago about breast cancers and even addictions, a lot of that was taboo. And one of the great things I find with social media and social platforms are that people talk about their diagnosis and their journey
Yes.
and what they've done.
Yes.
In a little while, I'm going to talk about a friend of mine who, what she did and how she found out that she had breast cancer. Let's start off, signs and symptoms. What are basic signs and symptoms that women and even men, as I said earlier, out of every new 100 diagnoses, 1 to 3 are men?
Right, so the most important thing when it comes to symptoms is to know that the best time to be diagnosed is when there are no symptoms at all. And that means
Love
that it's
that.
a detection made by mammography, by screening, when there are no symptoms. But if detection is delayed and the cancer has a chance to grow to the point that it's becoming measurable by sight or by hands, the most common symptom that people present with is a lump. A lump that is an enlarging lump that feels different than the surrounding tissue, typically firm or hard, and generally not painful, although it might be sometimes.
And the lump is on, and the same thing for the man, it's on the pec, but for the female, it's on the breast. Is there a specific area that a breast cancer lump occurs as per other places, or could it just be anywhere on the breast?
So it's quite different for men and women. For men, the easiest, it's almost always under the areola.
Okay.
99.9% of
here.
the time, that's the location.
Okay.
For women, it could be in any quadrant. There's more breast tissue in the upper outer portion of the breast, so
Okay.
statistically, that's where it's more likely to occur. But despite that fact, it can be in the inner breast, the upper breast, lower breast, behind the nipple, in any of those locations.
We talk a lot here as well about self-exam, self-examinations. For men and for women, the same. And basically, I think you were the one that said to lay on the floor. Did you not?
Or
say lay on
bed,
the
or
floor?
someplace that's level where you can sort of relax your shoulder, relax your chest. Yes.
And
that
for a
makes it easier.
man and or a woman,
Yes.
arm up,
Yes.
and you just take your hand and you check.
Right.
Is there a specific way you invite us to do it?
There are different ways, but the main point is to cover the entire area
Okay.
and to cover it both by light pressure near the skin and deep pressure, because something that is a tumor near the surface of the skin we very easily felt with light or deep pressure, but a tumor near the back of the breast won't be felt with light pressure. So feeling both with light and breast pressure and covering the entire area. Some people use a circular approach
Okay.
from outer to inner or inner outer. Others use a kind of a radial approach where you're like along 1 o'clock, 2 o'clock, 3 o'clock, 4
Right.
o'clock, a radial approach. The main thing is to cover the entire area.
And then also to go toward the armpit as well.
Yes, because the
Okay.
breast tissue extends up to the hair-bearing area of the axilla, so
Okay.
quite up, quite high. That's where lymph nodes are located as well. So you can not only assess breast tissue there, but also detect any enlarged lymph nodes in that location.
And then also one thing too is just because you do one side doesn't mean you don't do both sides.
That's right.
And then one thing, because we're already ready for our next break, is I said this before, if you are married or in a relationship, really look at your partner.
Yes.
Like remove your clothes and really look at your partner and see if something looks different, because they can see something that you can't see, and really have an open conversation with the one that you're with.
Yes.
Because most people are afraid to say, hey, I found this or I found that, but that conversation, because with every diagnosis of an illness, the loved one or the family member becomes part of that journey.
Right, and quite regularly patients report that their partner found a lump in the patient's breast. So, you know, they're
such a great note for that.
so
Christmas is going to look good. No, I love that, because here's the thing: your health is a conversation with the ones that you love. More with Dr. Holmes when we come back. Don't go away. Welcome back. Joining us from Adventist Health Glendale is Dr. Dennis Holmes, breast surgeon. Doctor, I really love that you said that there's a lot of cases that you say in regards to breast cancer and lumps were found by the partner and the husband and the special person in your life. A lot of people are so afraid of that, but to look at their partner and find things, but it does save lives.
Yes, it does.
I love everything about that. So our health, your health, anybody's health is a conversation that we should have with our loved one and family members.
It's a shared responsibility to make
sure. Oh, love that. Okay.
To make sure that our partners are safe.
I love that. Self-exam, if you find something, I always invite people to not Google search everything, because people panic, people get afraid. Most of us are dying all the time. And it could have just been like an ingrown hair.
Yes.
Okay. Mammograms are the go-to procedure for women to see if they have anything in regards to their breasts.
Yes. The American Cancer Society recommends yearly screening beginning at the age of 45, although with the option of screening at the age of 40, beginning at the age of 40, which I do recommend.
Great.
Continuing yearly until the age of 55 with the option of screening twice a year after the age of 55, but I also recommend continuing yearly at that point as well. But then if somebody, real quickly, if somebody was diagnosed with breast cancer at a younger age, yes,
they then, after surviving that, a friend of mine was diagnosed with breast cancer at 24.
Yes.
You would invite them to get mammograms consistently afterwards.
Well, the important thing is if you have a strong family history of breast cancer or family history of early age of diagnosis of breast cancer, then the screening guidelines don't apply as much to you.
Okay.
We actually modify them to start screening earlier and perhaps screen with other studies like an MRI, for example.
Great.
Because mammograms aren't very sensitive in a woman aged in her 20s. In that case, we would use ultrasound and perhaps MRI for screening, not mammography. Mammography works better for older women because the breasts are less dense, and mammography is better suited for screening non-dense breasts. If your breasts are dense, if you have a family history of dense breasts, then we combine mammography with ultrasound, mammography with MRI to improve its sensitivity.
And in regards to mammography, you said once a year.
Yes.
And that, well, a lot of women will come out of their mammogram and they will then get a phone call from their surgeon or specialist that they maybe found something and there was a shadow or something that they should come back in and get another mammography or an ultrasound. And a lot of times it just could be that the breast is very dense.
Yes, or benign tissue or cyst or some lump that doesn't cause any concern once it's been properly evaluated.
Mammographies, 100% accurate?
Nothing's 100% accurate. But in terms of diagnosing breast cancer that presents in a certain way, for example, presents with calcium deposits, which stand out very well, or a mass against a fatty breast background, those things stand out very well. And so for those kinds of the typical presentation of breast cancer, mammography has a sensitivity of about 85 to 90%. So it's a pretty reliable test.
Sure.
But there are challenging situations. A dense breast, which has a lot of glandular tissue, is very hard for mammogram x-rays to penetrate. So a mass can more easily hide in the dense breast. That's the main deficit, the main limitation of mammography. So for women with dense breasts, as I suggested, we don't rely upon mammograms alone for screening because of this possibility of missed cancers. We actually like to supplement the mammogram with ultrasound or with MRI.
And speaking of, breast cancer that hides, one thing too is a really good friend of mine, her name is Kim Douglas. She is a regular on the Ellen Show. She is a lifestyle expert on home and family, and she is this happy, upbeat woman that is a ray of sunshine. And she was working so much that she was so busy she missed her mammogram for 3 years. She went in and they found that she did have breast cancer, stage 0. She did a bilateral mastectomy because it was throughout the breast tissue. But what was fascinating is they found stage 3 cancer.
Yes, a larger cancer.
In her breast tissue.
Yes.
How common is that?
Well, it's not common, but I don't know her particular circumstances, but that, I think, represents some of the challenges of screening. The mammogram likely found calcium deposits, which is how the stage 0 breast cancer typically presents, with calcium deposits. But if her breasts were also dense, then a mass could hide very easily in a dense breast, and that sounds like what happened in her case.
Yeah, there was no family history on either side.
So, although we talk about the importance of screening mammography, I've already made the point that maybe ultrasound has a role as well, but it also is possible that a mass as large as a stage 3 cancer could have been detected by exam. And so breast examination does have a role, especially when the breasts are dense, or especially if you're not sort of up to date with your mammograms, because they're things that can grow without any sense of pain or other symptoms.
Does it grow quickly?
No, it's usually a very slow process.
So it does, okay.
A process measured over months to years.
Sure.
And so there are many opportunities with screening or with self-exam to find a cancer at a much smaller size than it ultimately is found to be when it's diagnosed.
And here's one thing too, is ask your mom, ask your family members about family history. And there's no history in her family, so it could just happen.
Right. And,
environmental life, and boom, you have cancer.
Right. We call that sporadic breast cancer. Breast cancer that just comes as a consequence of life and living and exposure to risk factors or lifestyle risk factors, environmental risk factors. This happens by chance, is not linked to your family history. There are some that are clearly linked to your family history, but most are not. Got
it. More Dr. Holmes when we come back, and we'll share with you new procedures if you or someone you love is diagnosed with breast cancer. Don't go away. Welcome back. Adventist Health Glendale recently received its 11th A grade in a row for patient safety from the Leapfrog Group. Rated 5 stars, the highest possible rating by the Centers for Medicare and Adventist Medical Services. Ranked by U.S. News and World Report's best hospitals in the top 10% in the Los Angeles area and top 5 of all hospitals in California. This year, Adventist Health Glendale celebrates their 115th birthday, so happy anniversary, Adventist Health Glendale. I am so proud to be part of that history, and part of that history is Dr. Dennis Holmes, breast surgeon. Wanted to share with you that my friend Kim Douglas has been a couple years out, and she lived a healthy lifestyle, and as we were saying earlier, it's kind of it just sneaks up on you, and any type of cancer. Her biggest platform now is don't wait 3 years to take care of yourself. And a mammogram only takes what? 30 minutes? 20 minutes.
20 minutes, yes.
So doctor, somebody is diagnosed with breast cancer, and stage 1, treatable.
Yes.
Stage 2, just as treatable?
They're all treatable.
They're all treatable.
But to various degrees.
Various degrees.
Yes.
And in regards to the type of treatment, we've heard of chemotherapy, radiation, holistic treatments, all types. When a woman decides to have breast surgery, a lot of women have shared that they were in fear of getting their entire breast removed. They're not going to feel as much as a woman, all these other feelings that go along with it. Mm-hmm. You brought a couple of props to share with women that they don't always have to have their breasts removed. Yes,
and in fact we know based upon large studies with long-term follow-up that the survival of breast cancer treated completely is the same whether the patient is treated with a mastectomy or a lumpectomy.
Love that.
So, complete breast removal isn't required for most breast cancers. The vast majority of breast cancers are diagnosed when they're the size of a nickel or smaller. Those breast cancers are diagnosed by screening, mammography predominantly. And so they can be treated with a very limited, targeted solution. Surgically, they could be a lumpectomy. We can also give radiation to just that portion of the breast. And so a lot of the work that I've done, research that I've done over the years has been focused on developing less invasive, more focused ways to treat breast cancer effectively while preserving the breast.
Love that.
And so I brought two things to discuss. The first, I talked about lumpectomy, which is what many women undergo when they have a diagnosis of early stage
Which is
breast cancer.
removing the lump.
Removing the lump and the surrounding rim of normal
Got it.
tissue. So just removing a part of the breast, not the entire breast.
Is there a stage of the cancer involved with this?
It's suitable for stage 0, 1, and 2 breast cancers.
Great.
And even some larger ones can be
Okay.
shrunk down to allow that to be performed.
Right.
But in general, this approach is for 0, 1, and 2. And the idea is after lumpectomy, a woman is expected to have radiation in most cases, and radiation is typically given as a daily treatment for several weeks. But there are ways of treating it in a more limited way, and there are ways of giving radiation as a single dose as opposed to a several-week course of treatment.
Sure.
This device here is one of the tools that we use to deliver intraoperative radiotherapy, radiation during surgery. So a lumpectomy is performed, the tumor is removed, it leaves a cavity. The device can be inserted into the cavity with a radiation source in the middle of this device. And then the tissue surrounding the device can be irradiated. We focus the radiation on the walls of the cavity because that's the place where the risk of cancer recurrence is highest. And it completely replaces the need for several weeks of radiation after. Once the treatment is done, we simply remove the device.
So the device
cavity
stays in the breast.
for 30 minutes or less.
Okay, that's more.
Yes.
Okay.
So the device is removed after the treatment, which takes generally about 20 minutes to 30 minutes. The wound is closed, and the woman goes home having completed lumpectomy, having completed radiotherapy, and a single visit to the operating room.
Wow, that's fantastic. Because a lot of the treatment was daunting. My mother had cancer. What was daunting is her going back and forth to get the radiation.
Yes, many people fear radiation. I mean, they
Like they've gone
understand
through
that's
the
a part of the
surgery.
treatment,
Yes.
but are they apt to have a mastectomy because they fear the burden of radiation, the time commitment, and the side effects of radiation? We can limit it with this treatment. And in fact, we did a long-term study which was published just this year in June, which showed that the survival for the treatment with this type of treatment was equal to the 6-week to 7-week course of daily radiotherapy given after surgery. So,
And you
it's-
basically get your life back quicker.
yes,
Doctor,
you can go
that's
back to normal
fantastic.
activities fairly soon. There's one other approach I'd like to mention,
Please.
which is the approach of tumor freezing. I described the approach just a moment ago of treating tumors by removing it, but we can also treat it with a device that basically is inserted into the tumor, this tumor being represented here in blue,
Sure.
whereby we insert a needle through the center of the tumor and then freeze it to a very cold temperature, freezing not just the tumor, but a rim of tissue surrounding the tumor represented by this blue foam. And by using this approach, we can offer selected women an office-based effective treatment for their breast cancer that eliminates the need for surgery completely.
Wow. So
Yes.
it freezes the cancer and all of it surrounding it.
Yes, just as shown here, the ice ball represented here by the blue foam.
And is this stages 1 and 2, or it could go up to 3?
Predominantly for stage 1, early
Okay.
stage 1. Thank you. 2 centimeters or less.
Wow, doctor, that's
Thank you.
fantastic. Unfortunately, we are close to wrapping out again. So 2 things. One, you're coming back sooner than next October.
Yes.
Talk to us about just living a healthy lifestyle and what men and women need to do, because we can't prevent it.
Yes, you know, that's one of the biggest, is the most obvious solutions, but the biggest challenge. It really just calls for making priorities. That, you know, the way to prevent breast cancer or reduce the risk of breast cancer, you know, is the same way that you reduce the risk of heart disease, diabetes, hypertension, and so many other health conditions. And it's by exercising, by maintaining
Minimum 150 minutes a week.
ideally, yes, maintaining a healthy lifestyle by eating proper foods, rich in fruits and vegetables, and minimizing weight gain. Those things will greatly improve the quality of someone's life, reduce the risk of the most common causes of death, cancer, heart disease, and diabetes, hypertension. And, you know, it doesn't require any medications. You also look better when you're doing those things.
It's true.
So for the vain among us, you know, there's a reason to do it there as well. But it calls for taking time. It takes time, and it takes making that a priority. We all have life demands. We have, you know, family, work obligations, but this is the most important investment that we can make in our lives, which is to maintain our health.
That is fantastic. Doctor, thank you for coming back and seeing us. And I'm going to see you sooner than not.
Please, please.
And I love that you save lives, and I love that you brought new treatments so women can get, are any of these used on men as well?
Yes, men can have a lumpectomy as well.
Okay.
Since the tumors are usually right behind the areola, we can take out the tumor and also treat them with intraoperative radiotherapy. And in some cases, we can also use the cryoablation or tumor freezing approach as well.
Thank you, doctor. Okay, so you heard it from Dr. Holmes. Just get your health on. Lots of exercise. Don't drink, don't smoke, don't do drugs. Ask questions. Self-exam, make an appointment to see your doctor. As I said in the very beginning of this segment, Adventist Health Glendale has followed all the protocols. It is safe to go back to the hospital. It is safe to go into the hospital. It is safe to see your doctor. Your life is depending on it. Self-exam, ask questions, have a moment with your husband, your partner, and just check each other out to see how each of you are doing. You can save each other's lives. Remember, the most important conversation you're going to have is about you and your health. Thank you for joining us here at HealthLINE, and you can see us on all forms of social media, Facebook at AH Glendale, LinkedIn Adventist Health, and you can always visit the website adventisthealthglendale.org, and I'm at Gregory Zarian. Take care, be well, be kind, be safe, and don't forget to wear your mask. We'll see you next time. Thanks.